Welcome to Successful Living with Bill Napick. Every week we talk about success and everything that goes along with it. You'll learn the principles of success, how to achieve success, and learn to overcome challenges that may be getting in the way of success in your life. You'll hear from Bill Napick, a radio personality and business development expert, along with insight from special guests. If you're ready to find your path to success or take the success you're enjoying to the next level, stay tuned. Successful Living with Bill Napick is on right now.
It sure is. Successful Living with Bill Napick, and today, Successful Living with Mike Alexander Sr. And in some circles, especially this one today, he is known as the Medicare Whisperer. So when we think about success, there are times in our lives, and certainly when we hit our 60s, especially 65, there are things that we need to do. There's benefits that we need to get, but there's also hurdles, and sometimes it's like putting a puzzle together to be able to get the things that to get our benefits. And he is here, the Medicare Whisperer, Mike Alexander Sr. Mike, welcome to the show.
Thank you, Bill. Thank you very much.
It is like a puzzle, isn't it?
It certainly is.
So let's tell people, first of all, Mike, what you do. You're called the Medicare Whisperer for many years. I remember talking to you years ago on another show. So let's tell people, first of all, what you do, and then talk about Medicare and what we should be thinking about.
Sure. Well, I've been doing this for 32 years, and what I am a Medicare consultant and Social Security consultant. I help people not only learn about Medicare, but I help them enroll in Medicare and help them enroll in their Social Security benefits at the right time for them. We try to make sure we do it.
And that's kind of a key, what you said right there, at the right time. And I will tell people, I would imagine that, not that I really know, but if you're in your 60s, let's say you cross that brink, you hit that decade, you're 60 years old, and a lot of us think, wow, here we are, we're getting older. However, one of the good things is as we get older, we have benefits. You mentioned Social Security, Medicare. We have benefits, but there's things that we must do to capture those benefits and get online with them. So
that's correct.
And it's not easy. That's why a consultant like you is very, very helpful.
You bet. Like I say, Medicare is like a maze and a puzzle. It's probably the best insurance you'll ever have. Having Medicare in a supplement program is probably the best type of insurance you'll ever have. But, you do have to enroll at the right time. So when you turn 60, you should start thinking about Medicare and Social Security and when you want to draw it. That's going to work out best for you. Like I say, it's very confusing. So what we do is we kind of guide you through the maze and make sure that you're in the right plan and you're taking your benefits at the right time.
Why is it confusing?
Well, anything with the government usually is. Anything with the government usually is confusing. Medicare's got 4 parts. You've got A, B, C, D, and people don't know what any of that means. They're lost.
So let's say someone, again, what we're going to put that, I'm going to emphasize it, 65 years, when we're talking Medicare, 65 years old, you need to sign up on Part A. Is that correct?
Well, you probably need to sign up for Part A and or Part B, depending upon your situation.
All right, let's say someone, and when we say situation, our employment or not
Correct.
being employed
Correct.
is our situation. So let's say someone turns 65 next month and they are employed and they have a good insurance plan. What should they do?
Well, they should go ahead and enroll in Part A. If you work for a company that has over 20 employees, your group plan is going to be primary. So you should enroll in Part A as long as you can continue to work. Enroll in Part A, and then about 3 or 4 months before you're going to quit or retire, then you should apply for Part B. Now, there is a penalty if you miss your deadline on Part B when you're employed. You have 63 days from the time you leave your employer's plan to enroll in Medicare Part B and a supplement. Failure to do that is a 10% penalty every year that you fail to enroll in Part B.
What if you fail to enroll in Part A and you're still working with a company insurance plan?
Okay, if you fail to enroll in Part A, you're okay, because at any time that you leave that company group plan, you can enroll in A and B and be effective for the following month.
Without a penalty?
Without a penalty.
So that's kind of good news.
Because you've got credible coverage.
So right there, we've talked about 2 simple situations. A person that's working, going to be 65 and one that's not, that might need the full insurance. And already there's a lot of things
That's
to
right.
know. So
Yeah, we haven't even gotten into Social Security yet. Yeah.
exactly. So I'm going to keep it simple and say, let's tell people, if they want to reach out to you, what's the website?
It's www.getagreatquote.com. And the phone number is 281-448-3040.
281-448-3040. Mike Alexander Sr., the Medicare Whisperer. And I think the good thing is, Mike, and I even remember this talking to you, I thought, man, when I get older, I'm going to call Mike because, quite frankly, people, if they're working, and I don't know, maybe even if you're not working, maybe you have a busy social life or whatever, we're too busy to sit and know all these ins and outs. And you're doing this, you said, for 30 years.
Absolutely.
So you know when the right time to do something is, what to do, and how to do it, right?
That is correct. Like I said, I don't know if I tell you, but when the reason I got into the Medicare business is I took care of my mother and my mother-in-law when they were very ill. And I learned a lot about Medicare. I learned a lot about Social Security. And I said, well, I'm a baby boomer. There's a whole lot of us out there. So I'm going to make myself a consultant to all the baby boomers, to help them with Medicare.
Okay, so let's go to this scenario. Let's say someone is 65 and they retired last month. They're 65, so they want to make sure they have great health insurance. So they sign up for Part A, or they talk to you about signing up for Part A. What else should they do if Medicare is going to be their main insurance and they don't have a company plan, better put?
Correct. So what they should do is they have 7 months to enroll in Medicare A and B. They should enroll both in Medicare A and B. They have.
And is that 7 months after their birthday?
No, it's 3 months before you turn 65, the month of your birthday, and 3 months after your birthday. That's the open enrollment period for Medicare when you first are eligible.
At least they give you a nice window there.
They do.
But don't forget to
No,
do it, because then
that's right.
here come the penalties on the Part B.
That's right.
Now, Part A and B is insurance, Medicare, we'll call it, right? Is that enough?
Well, no, it's not. Part A is the hospital part of Medicare. Part B is the outpatient part of Medicare. That's going to cover about 80% of your bills.
So we'll call that kind of basic.
Right.
But we're going to need to have great insurance. We're going to need to do other things.
You're going to need a Medigap or a supplement or Medicare Advantage in some cases for some people.
So let's hit some of the bullet points of those things.
Sure. So Medicare supplements have 4 to 5 different plans. There's the Plan G, there's the Plan N, and there's also what's called a high deductible Plan G. And all those are going to supplement what Medicare does not pay.
And all those have a cost.
All those have a premium. That's correct.
But I'm going to guess it's reasonable. I don't want to put words in your mouth, but it's reasonable compared to if we were 20 years or 25 years old and looking to have insurance outside of a company plan.
Yeah, it's much less than you would pay for a commercial insurance plan, I can assure you. And the benefits are usually greater because there's either no deductible or very low deductible.
You know what I'm thinking of? I'm in the real estate world a lot, and I know realtors are independent contractors, and there's other independent contractors out there, and primarily realtors don't have great medical plans. They have to, all those years, sign up somewhere and probably pay high premiums. But good news, if you're a realtor and you're 65, are things getting reasonable?
Absolutely.
There you go.
It pays to get older.
Okay, so look, you could be the Medicare whisperer and the realtor's friend.
That's right.
Look at that.
Absolutely.
So now you got a second title at least. So many things to think of, but just right there, Mike. Part A, Part B, then you're throwing in Part G. How much of the alphabet are we using for all the things in Medicare?
It's a complex alphabet. That's why our motto is: if your Medicare looks like the New York Times crossword puzzle, call us. We have the correct answers.
Well, it's good to know that someone like you is out there to help people. As you've been doing this so many years, give us an idea of some of the things that you see out there, or maybe a case study or something that surprised you. Share with us some of the things people deal with.
Well, one of the things that I've noticed the most is that there's a big misconception. People go on COBRA. They work for a company, they turn 65, so they take Cobra. Well, I'll just take Cobra, then I'll go on Medicare. Well, what a lot of people don't realize is Cobra is not credible coverage with Medicare. So if you're 65 and you retire and you don't have Part B and you go on Cobra, you're going to be subject to that 10% penalty. Even though you're covered by Cobra, Medicare does not consider Cobra credible coverage.
What are some of the other things what are some of the other mistakes people make or things they should stay away from, let's say?
Sure.
Generally, because everybody's situation is different.
Absolutely.
The things that you buy in addition to Part A and B are different. But generally speaking, there are some things we should avoid.
Well, one thing that you have to be sure of is make sure that you do a complete needs analysis so that you know what plan is going to be right for you. I see a lot of times where people will sign up for, let's say, a Medicare Advantage plan, not realizing that certain hospitals are not in that plan, certain doctors are not in that plan, and then they're stuck in that plan, and they're in it for a year before they can get out of it. So MD Anderson comes to my mind. MD Anderson does not accept any Medicare Advantage plans. So if you had a history of cancer in your family, you definitely would want to look at traditional Medicare in a supplement versus a Medicare Advantage plan in that case.
And let's tell people the Advantage plan. What is the Advantage plan?
Sure.
And why do they call it Advantage if it sounds like it's a disadvantage? But
sure,
go ahead.
Sure, no. Traditional Medicare, A and B, pays first under traditional Medicare. Then the supplement picks up what Medicare does not pay. On a Medicare Advantage plan, it's completely different. Medicare pays the Medicare Advantage plan a monthly fee that they would normally allot for your Medicare benefits, and in turn, that private insurance company pays your Medicare, all your Medicare bills. So what they do, though, is they have a network that you must adhere to. Plus, you're going to have some out-of-pocket costs that could be as high as $7,000 a year on a Medicare Advantage plan, whereas on traditional Medicare, the most you'd be out with the supplements about $185.
So is there a charge for the Advantage plan?
Some have charges, some are free, but the ones that are free, the networks are usually a lot tighter.
So it sounds to me like for many people, the supplement plan would be best.
Yes, supplement's always the best way to go. Unless you can't afford a supplement, then the Medicare Advantage plans are there for you as an option. You have a lot of options with Medicare.
How is the supplement plan priced?
They go for, if you're turning 65, you can get a supplement from less than $100 a month to as much as $200 a month.
So for $200, you're getting better coverage?
Oh, yeah. You can go to any doctor, any hospital, anywhere.
So then that way, for someone that's even retired, or whether they're working or retired, if they go to another city, something happens, you on the skiing trip, you break your leg or
That's
something
correct.
like that, the supplement plan is good to have.
You bet. It's going to cover you anywhere you go in the United States.
If I move to another state, same thing.
You're covered.
Right? Mm-hmm. Very interesting. Okay, before we get into Social Security, we can talk about that too,
Sure,
right?
sure.
What else should we know about Medicare? And again, let's give them, you really want, the big number it sounds like is 65, right?
Correct.
So if you're approaching 65, and quite frankly, I'm going to say if you're 50, 60 years old, you should always be planning ahead no matter what, because you live long enough, you're going to need money, you're going to need, certainly healthcare is gigantic, but certainly 60, you better be thinking about it. But here comes 65, Medicare. What else should we know?
Okay, so you also have to enroll in Medicare Part D, which is a prescription drug plan with Medicare, okay? That has a penalty, too, for not enrolling. If you don't enroll when you're supposed to in the Medicare Part D, you're going to pay 1% penalty for every month that you don't enroll when you're supposed to.
All right, wait a minute. So now I have to sign up for Part A, Part B, and when I sign up for Part B, I'm not automatically in Part D?
No.
And this is why you need the Medicare Whisperer, Mike Alexander Sr. So is there anything else? All right, so here we go. 65, and let's say I don't have company insurance. I'm signing up for A, B,
and
D for sure. And
Correct.
once I do that, I'm okay.
You bet.
What about, is there a C? Why did we skip C?
Part C are the Medicare Advantage plans, okay?
Okay.
That's what Medicare Part C is, Medicare Advantage.
And then after D, it gets to the supplemental landscape.
Right.
Look
That's
at that.
correct.
I'm learning, aren't I?
You bet. You're getting pretty good. You're hired.
Mike Alexander, the realtor and independent contractor's friend, in addition, Medicare Whisperer. And the website is getagreatquote.com. See,
Yes,
I didn't even read that. I remembered it because it kind of has a nice ring. Getagreatquote.com. Mike Alexander Sr. Now, let's hit a little bit about Social Security.
Okay.
What else? What are the numbers where we should start thinking about that? It's a little different.
Sure. Social Security is a little different. Matter of fact, Social Security for most people born after 1952, your maximum retirement age to get the most benefit is age 66. Some people, it'll be 66 and 2 months. Some people, 66 and 4 months, up to age 67. Okay. And that goes by your year of birth. So you need to be sure that you don't enroll too soon, because then you're going to lose part of your benefit. Like, say your benefit is 66 and 2 months, but you enroll at 66, you're going to lose about 15% of your check by doing it too early. Okay.
And they won't have any compassion to say,
No,
I screwed up.
They
You're
have
locked
0.0 compassion, believe me.
You called, you're locked in.
That's right. You're stuck.
Sorry, Charlie. Right.
Yeah. And the other thing is, for some people, a lot of people nowadays, including myself, we're working past age 65. And a lot of people don't know this, but if you wait, every year that you wait past your full retirement age, say 66, you get 8% more on your check.
Well, that's interesting.
Up to the age of 70.
All right. There's something new I learned. So I thought it was 66, you get one amount, and until you're 70, then you get another amount. But what you're saying, if I'm understanding, 66, you get one amount, but if you wait to 68, you get a little bit more.
You sure do.
So there's each year.
8% each year.
Look at
And
that.
it depends on everybody's situation. Some people should take it right away if they need the income. Some people take it, invest their Social Security money. But, for some people, it pays to wait. You also have to look at your tax situation, because Social Security is going to tax 85% of your check. 15% they don't tax. But if you make a lot of money, they'll go back and pull some of that money away from you on your Social Security check if you make over a certain amount.
What's that amount?
$44,600.
So if you make over $44,600, why don't they just make it even? But okay, 44.6. So I'm still working. I'm making over 44.6. I'm 66 years old, and I'm making 50,000, let's say, and I want to take the benefit at 66.
Your full retirement age, right?
The full retirement age, I might get $2,800, and then the taxes is a whole nother deal.
Right. And again, everybody's situation is different. So what we do is we sit down, we look at your situation. Do you plan on working? What investments you have? What additional income? And we'll give you when is the best time to take it. We'll let you know based on your particular individual situation.
Well, and that's a good point. You mentioned that people at this, hopefully we've saved some and have been able to preserve
Sure.
some of our things. Things happen in life where our
does.
stockpile can get depleted. But you mentioned the role of investments, right?
Correct.
Let's say someone has an IRA with maybe $1 million in that IRA. Then they're starting to think about age 70, they have to take some money out. So now you got a
required
whole
distribution.
gumbo of your income.
That's right.
You're taking money out with your required withdrawals. You have some Social Security coming at you.
Mm-hmm.
Man, it's complicated.
And the other thing people don't realize is that, if you miss that deadline on your distributions from your IRA, it's a pretty stiff penalty. It's like a 50% penalty.
So much to know. Wow. Well, the last 3 minutes or so, Mike, what are some of the other things you think people should know about? Again, Mike Alexander Sr., I heard and talked with you many years ago. Mike, here we are. I'm getting older. I may need your services sometime soon. In the meantime, getagreatquote.com. You can find the coordinates on Mike Alexander Sr. He is known as the Medicare Whisperer. Also, you can give him a call, 281-448-3040. But I'm going to tell you, Mike, if they just remember Medicare Whisperer, you're going to come up.
That's right. There you go.
In fact,
Yeah.
I'll tell you another story after the show. But in the meantime, the last couple minutes, what
Sure.
else you want people to know that's important?
Another thing that's very important is, and I want to go over, is Part D, the prescription plan. It's very important that you find the proper prescription plan that covers the meds you take. there are 27 different Part D plans,
Oh.
and they all have different formularies. So if you don't do the research or have someone like us do the research to make sure that the medications that you take are covered by the drug plan, you could be substantially out a lot of money on the drugs if you don't pick the right plan.
All right, say that again. I'm still in shock.
Sure.
On the prescription plan, there's how many different?
27. Currently, there's 27 different Part D plans, and each one of those plans has a different drug formulary. So just because one of them's cheaper or one of them is more expensive, you may think the most expensive one is the best. A lot of times that's not true. The whole thing on the prescriptions is you've got to make sure you have the plan that covers the drugs you take.
Well, let's say you start out and you sign up for a plan. You're not taking any drugs, or you're not needing to, right?
Right.
So you sign up at 65 A, B, and you're on some kind of D plan to be on just to be on a plan, I guess. But you're not even taking medication. But then along the way, here comes a year later, all of a sudden you need something.
Right.
Can you adjust these plans? Or?
Yes. Medicare gives you an open enrollment date every year of October 15th through December the 7th of every year to change the way your Part D plan is or change the way your Medicare benefits are delivered. If you're on a supplement, you can go to Advantage. If you're on Advantage, you can possibly go back to a supplement and change Part Ds.
That's good to know. That's good. So once a year, you can adjust.
That is correct.
Very interesting. Okay, Mike Alexander Sr. Mike, one last thing. Anything else?
Nope, I think I've covered a lot today. I don't want to confuse everybody too much.
Well, it's interesting to even talk about these things. It is confusing, but it just makes the case. You have to talk to someone that's an expert in these things like you, Mike Alexander Sr., the Medicare Whisperer. Give him a call. Getagreatquote.com is your website, right?
Yes, sir.
Getagreatquote.com, and you can give them a call at 281-448-3040. So when you're 60, start thinking about these things, especially Medicare. When you're 65, call the Medicare Whisperer. Thank you, Mike, for being on the show.
Thank you, Bill. I appreciate it.
You've been listening to Successful Living with Bill Nampick, who's getting older by the minute, and Mike Alexander Sr. Thank you, Mike.
Yes, sir.
Go to radiobill.net for more information and surprises, and we'll see you next week.